Going to talk about the lateral femoral cutaneous nerve of the thigh block. To perform this block, there are two ways to scan this structure. You can start scanning the anterior superior iliac spine, looking for the sartorius muscle, moving the probe down, and once you see the sartorius muscle in the view, you will move the ultrasound probe laterally, looking for the tensor fascia lata, and the nerve is usually located in a fat-filled flat tunnel in between these two structures. The other way to find this nerve would be feel for the anterior superior iliac spine, and around 2 to 3 finger breadths below the anterior superior iliac spine, ask the patient to lift the leg and feel for the groove, which is the groove between the anterior sartorius muscle and the tensor fascia lata. And this groove will basically show you the fat-filled flat tunnel, which is the structure that will house the lateral femoral cutaneous nerve. On this picture, let's start scanning the anterior superior iliac spine. So anterior superior iliac spine moving down, looking for the sartorius muscle. Once you look at the sartorius muscle, move laterally. Here we have in this structure the lateral femoral cutaneous nerve in the fat-filled flat tunnel, which has already branched. We have the tensor fascia lata, sartorius muscle. You can block this nerve by in-plane technique, bringing it from lateral to medial, or you can block the nerve by using an outer plane technique, bringing the needle down into the fat-filled flat tunnel. Usually the pathology is more proximal. Once you find a needle distally, you will move proximal. When the nerve starts to move towards the top of the sartorius muscle, and there's another place where the nerve can be blocked, and the pulse radiofrequency treatment can also be performed in the similar location. To show you the needling, you will perform the needling in plane or outer plane. Here we have high frequency linear ultrasound probe, the needle coming from lateral to medial. You can perform it outer plane by placing the structure in the middle of the ultrasound screen and bringing the needle in the middle of the probe, and you can inject 3 to 4 cc's of local anesthetic and steroid mixture to perform this block. To do the pulse radiofrequency treatment, the settings would be 5-minute cycles times 2, 42 degrees, and pulsed radiofrequency can be done at this nerve. Thank you.